Insert the Andra gauge into the patient's mouth. Align the center mark of the blue maxillary tooth cradle with midline of the upper anterior teeth. Have patient bite lower anterior teeth into the purple mandibular tooth cradle. If needed, dial in the sagittal position by adjusting the gray pinion. Dial in the desired anterior or posterior position by adjusting the blue pinion. Dial in the desired vertical position by adjusting the purple pinion. Remove the Andra gauge from the patient's mouth and lock both the vertical and anterior-posterior locking screws. If needed, apply a small bead of bite registration material into the gap formed by the maxillary and mandibular tooth cradles. Allow the bite registration material to set. This provides extra support between the upper and lower cradles of the gauge. Apply bite registration material to the upper portion of the bite fork. Apply enough bite registration material to compensate for the desired vertical position on the upper portion of the bite fork. Now apply bite registration material to the lower portion of the bite fork. Insert into the patient's mouth, upper teeth first, by aligning the center mark of the maxillary tooth cradle to the upper anterior tooth midline. Then have patient bite lower teeth into purple mandibular tooth cradle and hold until registration material sets. Have patient open mouth and remove Andra gauge. Now that you have obtained the best bite registration possible, simply send the entire Andra gauge with your captured bite registration to your preferred lab.